talk to you today about a pandemic that was announced in April of 2009 by the World Health Organization, also known as WHO. This pandemic was introduced foremost as the swine flu and then later as H1N1. According to the Mayo Clinic, the pandemic of the H1N1 was issued at a level 6. This is the highest that a pandemic can be categorized. The level of the pandemic is not measuring the severity of the illness, but how widespread the illness is globally. The World Health Organization is still recommending, after 7 months, border closings, travel restrictions, and quarantines around the world. Due to the severity of this widespread illness, I want to inform everyone of what the H1N1 is, the symptoms to look for, and how we can keep ourselves healthy. The H1N1 flu virus is a new virus causing illnesses here in the United States as well as globally. It was originally termed as the swine flu, originating from the influenza pigs could be infected with in the North American regions. However, with more study, this virus has been found different than any other flu viruses we are used to dealing with. The H1N1 virus has 2 genes found in the flu viruses that circulate through Europe and Asia, as well as bird and avian and human genes. The H1N1 has proven to be very contagious. According to the Center for Disease Control, or CDC, the virus can be spread by those who are infected 1 day before the symptoms start and up to 7 days after getting sick. This can last longer in children or those who have weakened immune systems. The H1N1 can become airborne when someone who is infected coughs or sneezes without covering their nose or mouth. Others can become infected by touching contaminated objects. Healthy individuals who touch these contaminated objects can then transmit the virus when touching their nose, eyes, or mouth. Signs and symptoms of this virus include fever, coughing, sore throat, runny nose, body aches, headaches, chills, and fatigue. The CDC has also found that there have been symptoms of just respiratory symptoms and no fever. So please take serious precautions if any of these symptoms appear simultaneously or gradually. There have been emergency signs for children who have H1N1, and parents should take note of these symptoms. Faster trouble breathing, bluish skin tone, not drinking enough fluids, not waking up or interacting when spoken to, and fever with a rash. Emergency signs in adults are difficulty breathing, pain or pressure in chest and abdomen, sudden dizziness or confusion, and severe persistent vomiting. The above symptoms can be more serious in those who are considered high risk patients. Patients who are considered high risk are 65 years or older, children 5 years of age or younger, women who are pregnant, and anyone with other chronic medical conditions such as diabetes, heart disease, asthma, and kidney disease. 70% of people who have been hospitalized with H1N1 or have had other underlying medical conditions. Flu-related complications have also played a role in making this virus more serious, such as those with bronchitis, pneumonia, sinus infections, and ear infections left untreated. To prevent ourselves from getting sick, there are precautions we can all take. First, it has been recommended by the WHO and CDC that getting the vaccine is an important step in preventing the H1N1 as well as getting the seasonal. The next few steps are everyday precautions that you can take. For instance, cover your mouth and nose with a tissue when sneezing or coughing, and then throw the tissue away afterward in the trash. Secondly, wash your hands with soap and water as often as possible. When soap and water aren't available at the time, use an alcohol rub. However, as soon as possible, make sure to wash your hands. Try to avoid others who might be ill. Avoid touching your mouth, nose, and eyes. If you or a family member feels that they might have the H1N1, here are some steps to take in order from spreading the virus further. Stay at home and away from others for at least 24 hours or until your fever subsides without fever-reducing medications. The only time you should leave your home is while you are sick is to seek further medical help. Now that we all have a better idea of what the H1N1 is, how it is spread, and how we can prevent others from getting it, I want to take a moment and discuss a commonly asked question on this topic. The question is, how do I clean contaminated objects without getting sick myself while taking care of others who are? When cleaning bed linens of someone who is sick, make sure not to hug the linens close to you while carrying them to the washing machine. And when washing the linens, make sure they are washed in the hottest setting as well as dried. If you are washing dishes used by someone infected, make sure to wash them in a dishwasher or with hot soap and water. After handling anything that has been contaminated, always wash your hands immediately after the soap and water. Make sure to clean all surfaces with an antibacterial disinfectant. For more questions or concerns on this topic, you can visit the CDC and type in H1N1 in the search box. This virus again is very contagious and has already led to the deaths of many individuals around the world. It is up to everyone to do their part in ensuring that we follow the proper protocol and procedures and preventing the further expansion of the H1N1.